happens if your dog tests positive for canine parvovirus? There is no specific cure or medication for canine parvovirus. The dog goes into multi-organ failure and death. The chances of survival can go as low as 9%. Vaccination is not enough. The virus can also affect the heart muscle. How to eliminate this virus from our environment? Welcome back to our channel, everyone. Today we'll be discussing about a very important topic that every pet parent should be aware of: canine parvovirus. This is one of the most deadliest and contagious diseases affecting our dogs. Stay tuned till the end because we'll be discussing everything that you need to know to protect your dog from this virus. The story of canine parvovirus begins in the late 1970s. Veterinarians all around the world started noticing a sudden outbreak in severe gastrointestinal diseases in dogs. Initially, they did not know where this virus came from, but researchers soon discovered that this virus was closely related to feline panleukopenia virus, which affects cats. The feline panleukopenia virus underwent 2 or 3 mutations, which allowed it to jump species and affect dogs too. But this rapid spread and deadly outbreak is because that the virus is extremely resilient and it can survive in the environment for months together. So how does a dog become infected with parvovirus? The virus primarily spreads through direct contact with an infected dog or indirect contact with a contaminated object. This can happen in dog parks, kennels, grooming centers, veterinary hospitals, or even when you take your dog out for a walk. And remember, even if your dog is 24/7 indoors, you can be the reason that your dog gets infected because we can carry the virus on our clothes and shoes too. So there is literally n number of ways that your dogs can get infected with the parvovirus. But you should also know that not every dog which comes in contact with the virus gets infected, because there are several factors that come into play, including the immunity status of your dog, the number of virus your dog is exposed to. When the combination of the factors are right, your dog becomes infected, and a series of events start with the virus making way into your dog's body. When the virus enters the dog's body, it first invades the lymph nodes in the throat, where they make multiple copies of themselves and attach to the WBC cells and enter into the bloodstream. The virus mainly targets rapidly dividing cells. So the primary target of the virus is the bone marrow and the lining of the intestines. When the virus first attacks the bone marrow, which is responsible for production of WBCs, the body's immune system gets affected. With fewer WBCs in the body, our body's ability to fight infection is severely compromised. And at the same time, the virus starts affecting the lining of the intestines. The lining of the intestines is like a door. It allows nutrients and fluids to be absorbed into the body and prevents bacteria from entering into the body. When this virus starts degrading and affecting the lining of the intestines, absorption of nutrients and fluids are hampered and bacteria can enter into the body. When the lining of the intestines are completely damaged and the bacteria starts entering into the body, it starts spreading into all other organs. With the immune system already compromised, the body is not able to fight off the bacterial infections and all the organs starts getting affected and the dog goes into multi-organ failure and death. In rare cases, in very young puppies, the virus can also affect the heart muscle and cause myocarditis, that is inflammation of the heart, and can lead to heart failure, though it is very, very rare. Recognizing the symptoms early on can be a lifesaver. Dogs infected with parvovirus often show signs of severe vomiting, bloody diarrhea, lethargy, and loss of appetite. The bloody diarrhea is a result of the destruction of the intestinal lining, which also causes loss of protein and blood, further worsening the dog's condition. The lethargy and loss of appetite are due to severe dehydration and systemic infection. When the treatment is started in the first 24 to 72 hours of infection, then the chances of survival are as high as 85 to 95%. But as the treatment is delayed, the chances of survival can go as low as 9%. Canine parvovirus is not always fatal, but when it kills, it is a result of either dehydration and shock, along with the toxins produced by the intestinal bacteria which is roaming throughout the bloodstream. If you suspect your dog has parvovirus, it's crucial to get them to the vet immediately. The diagnosis is typically confirmed using a fecal ELISA test, which detects parvovirus in your dog's poop sample. This test is very similar to an at-home pregnancy test kit. It's quick and you can get the result within the next 15 minutes. In addition to ELISA test, blood test may be used to check for low white blood cell count, which is a common sign of the infection. X-rays and ultrasound may also be used to rule out other causes of the symptoms. So what happens if your dog tests positive for canine parvovirus? A point to remember is that there is no specific cure or medication for canine parvovirus itself. Only supportive care can be given. This includes intravenous fluids and nutrition to replace the lost fluid and nutrition, anti-nausea medications to reduce vomiting, antibiotic to prevent secondary bacterial infections from intestinal bacteria, and very close monitoring. In some cases, plasma or blood transfusion may be required to replace the lost protein and blood cells and also support their immune system. Remember, the goal of parvovirus treatment is not to kill the virus but to provide support to the body so the body can fight off the virus. I can't say this enough, prevention is better than cure. Vaccinating your dog is the most effective way to prevent parvovirus. If you need to know more about vaccination schedules, please comment below. I'll make an entire video about it. But remember, vaccination is not enough. Maintaining a clean environment is also very crucial because parvovirus is very tough to kill. Disinfectants which work very well to kill parvovirus are accelerated hydrogen peroxide and sodium hypochlorite solution, which is nothing but bleach. You can mix 1 part of bleach in 30 parts of water and disinfect the area and also the things which might be contaminated. Coming to the end, parvovirus is a serious threat, but with the right knowledge and precautionary measures, you can protect your dog. Remember, keep your surroundings clean, stay up to date on the vaccinations, and recognize the symptoms early on. If you found this information helpful, please do not forget to give a thumbs up, comment below, share with your friends, and do not forget to subscribe. I'll meet you again with another video. Bye-bye.